Okay, I'm going to introduce myself quickly as well. I have been in private practice for 30 years and I have been in 3 different fields. But all of these fields I'm going to mention, I am working with trauma every day. So I'm a traumatologist and that is my speciality. I am a clinical social worker. I was first a clinical social worker, and then I was a counseling psychologist, and then I became a forensic criminologist. So I work with crime, and I work with individuals and couples and families and children and adults and old people as well. So when we work in the rural area, there isn't a lot of speciality. There isn't a lot of professionals. There's not a lot of assistance. So that is why we have to be able to do a lot of things. We work with sleeping problems, anxiety, depression, eating disorders, anger problems, anything underneath the sun. The thing that I want to tonight discuss is suicide. And this is a very sensitive topic, but it's a very necessary topic. And the reason why is I'm going to show you quickly, and I'm going to jump some slides. There are some statistics that you can see. So at the moment, and this is 2026 statistics, because I'm at the National Center for Child Protection as well. We have about 12 children committing suicide in South Africa every day. And this is a high statistical number. And unfortunately, statistics aren't always correct. So why? Because we don't have always all the cases being reported to us. But we can see that we've got about 23 completed suicides every day in South Africa. So that's an alarming number. And then what also is a concern is it's rising every time when we see the children between 15 and 19 years trying to commit suicide or where there is completed suicides. And that is maybe, I think, one of the reasons they asked to come and just discuss this tonight with you all. And I want you to be very open with your questions. And no question is going to be silly or not important. But there's 2 things that I want to concentrate on. The one thing is why this is happening. I think that is a question everybody is asking us. Why is this a rising concern? And the second thing is, what can we do to prevent this? Because suicide is something that we can prevent. And that is why I thought of showing you first a video. So can we show the first video? And this is a video about a mom that is in Washington in America, and her child committed suicide. And this shows us a bit of what our parents normally will tell us as well. So this is something to show you this is a phenomenon that is a reality, and this is what is so difficult about suicide. Sometimes we see symptoms and sometimes we don't. And that is why it's really an intricate phenomenon. So this is a mom and a counselor. She's also a psychiatrist and she works at this clinic. So you'll see there's a helpline number, but that's an American number. I will afterwards, there's a slide with numbers and I will also provide these numbers. It's numbers that you can call 24/7. So if there's a friend and you're concerned about a friend and you can't get a school counselor or somebody like a doctor to assist you, then there is numbers in South Africa that you can contact. It's like hotline numbers that you can contact as well. So that I'm going to provide to everybody here, and it's also on the slides at the end. So that's the one thing that I want you to remember. And the other thing is, there is counsellors here. I'm a counsellor for Waterberg area, but I also work nationally. But there's also a lot of other people, and I think we must, at a certain stage, maybe make a list of contact numbers available for you guys, so that you know whom to contact in Nylstrom if something happens or you're concerned about somebody else that are showing signs or symptoms of suicide. So let's watch that first video. And then we'll go on.
In October of 2012, I lost my 14-year-old son, Palmer Burke, to a suicide by firearm. Palmer was probably one of the most just creative outgoing, thoughtful kids. Here it is 4 years later, and I still feel like I'm in shock when I look at the great life my son had. He was, tall, handsome, athletic, had tons of friends and lots of successes and plans, and it just ended. We really had no idea. Suicide was not on our radar. We didn't know enough about teen mental health or signs of suicide or teen depression.
One of the challenging parts of identifying kids at risk for suicide is that this can come up and look very different for different kids. So some of the time we have adolescents show up in our clinic who are functioning very, very well, and no one has any idea that they're suffering. And then there are teens who have more clear risk factors, like they have a history of depression or self-harm. I think there can really be a diverse array of how teens look when they're distressed, and paying attention to the changes in their behavior becomes really key.
Looking back, there definitely were some signs. They were subtle, but he was grumpy. He didn't want me to come into his room the night before, which was unusual. I wish I'd known to ask him and to dig a little deeper instead of shrugging it off, thinking it was normal teen behavior. If your child gets a sprained ankle, you'll run onto the soccer or football field and you'll know what to do. But when they start to show signs that they're not mentally well, I think a lot of parents don't know what to do.
Ask the question, are you thinking about suicide? Asking the question does not raise risk for an individual. In fact, people can really feel a lot of relief. And parents are also, they know their children so well that they are really the experts here and can identify if there's a change that seems like it's more than momentary. We want to look for a change that's, abrupt and not transient.
One of the things we learned after losing my son, Palmer, was that kids who are feeling suicidal or in a mental health crisis will often tell their friends. And their friends don't know what to do with that information. So I think that's another important part of suicide prevention is telling your kids that if a friend says to them, I'm feeling depressed, or I'm feeling suicidal, or I know where my mom or dad keep their gun, or any of those things, that kids should not be afraid to tell adults that they're concerned about a friend. I wish I had checked my son's text messages and emails and Facebook messages regularly. And that was one of the first things I started telling parents after I lost Palmer. And they all said, well, no, that's private. That's like, no, I probably could have saved my son's life had I known what was going on.
If parents are concerned about their child or teen attempting suicide, one of the really critical things is to reduce access to lethal means.
Securing your firearms, securing your prescription drugs, your non-prescription drugs. These are two of the most commonly used methods in Washington State, and they're just so simple to secure them and keep your children and family members safe.
If you're concerned about your child, but it is not urgent, then you can reach out to your primary care physician or the school counselor. If you're concerned that your child is in crisis right now, call our crisis line, and they're available 24/7 and will help guide the parent to the next steps that are necessary. When teens are suicidal, it's not that they necessarily want to end their life, it's that they are in unbearable pain and they don't see any other way out. One really important thing that parents and other people supporting teens can know about suicide is that it is preventable. As a community, we can remain awake to suicide risk, and we can intervene when teens need it most.
Okay, so that gives you an idea of one of the cases that we see. So the first thing that I need to concentrate on is, I think tonight, is why this is happening. And there's different reasons why, but I'm going to make it, or try to make it very simple. If you take your body and you just see it as a glass, and life as a tap that's open, dripping inside this glass. That means a lot of things happening every day, causing anxiety and negativity, and then also thoughts that we're having about ourselves that's not constructive but very destructive thoughts. When that remains and it's constantly there, then you can picture how this is going to fill up. Okay, over time it fills up. And if you don't open up or vent or explain or discuss this with somebody that you trust, then you're going to overflow, like the last drop in the glass. It's just going to overflow. And when people, children, everybody, and me included, if we do not talk about this, then unfortunately it ends up in different things. It's not always suicide. It can be cutting, it can be a eating disorder, it can be a sleeping disorder, it can be anxiety, it can be panic attacks, it can be anything. But unfortunately, our thoughts are our biggest enemy. So that means if we think negatively, and it's a constant battle in our minds, then our brains don't get a recipe, a plan, doesn't feel better. And unfortunately, then the brain will release two types of chemicals, adrenaline and cortisol. And when that pumps, it pumps in your system. And that's why you'll get panic attacks, migraine headaches, sweaty palms, a stomach ulcer, muscle spasms, a skin rash. You can't concentrate on your schoolwork, maybe. You can't sleep at night because your brain is in constant overthinking. And all of that remains in your body. And I don't think God created us to be like storage facility, storing up all of this negative feelings and thoughts inside of our bodies. So that is the risk that we're having. And that's why some children are very, very good at suppressing that information, keeping it inside of their bodies. Others can't. You can see it in their face, they start crying, and that is when we will ask a friend, are you really fine? And if they turn away or look away or start crying, we don't leave that at all, because that was the pain that she talked about. It's constant pain inside of their bodies. So that is why we have a responsibility towards ourselves and towards other people to report it. Because then we help them to vent, to open up, to pour out everything that they have in their system. So it's very dangerous. It's absolutely dangerous. If you have one negative thought, it leads to other negative thoughts. You ruminate it in your system and your brain is stressing out. So if you're going to think crap, you're going to feel crap, you're going to look crap, you're going to be having this crappy feelings, thoughts, and behaviors. So I'm going to show you one more video. And this is a neurologist and a psychologist and a psychiatrist. He's absolutely wonderful. And he works with the brain. I do a lot of training with him. And he is going to explain more about how dangerous it is to have negative thoughts about ourselves, our lives, our self-esteem, our possibilities. If we fail, what do we tell ourselves? So this is very important. I think this is one of the biggest things I'm identifying in my practice as the reason why children are giving up on their lives. So let us look at the second video, and I will put my hand up when we can stop that video.
Whenever you have a thought, your brain releases chemicals. Whenever you have an angry thought, a hopeless thought, a helpless thought, a critical thought, your brain releases chemicals that make you feel that. And it happens immediately. Your hands get colder, they start to sweat, your muscles get tense, your breathing becomes more erratic. The opposite is true. Whenever you have a happy thought, a hopeful thought, a loving thought, a grateful thought, an appreciation thought, a kind thought, your brain releases a completely different set of chemicals. muscles that warm your hands, dry your hands, relax your muscles, cause your breathing to be healthier. And so the exercise is super simple, but you have to do it 100 times. Whenever you feel sad or mad or nervous or out of control, write down what you're thinking. And then ask yourself, is it true? But basically, write down the thought, all my colleagues hate me, and then 5 questions. Is it true? No. I've had 10,000 colleagues refer patients to me, so it's not true.
Wow.
Is it absolutely true? If 1 is no, 2 is automatically no. 3 is, how do I feel when I have the thought, all my colleagues hate me? I feel lonely.
Yeah.
And I feel sad. And I feel angry. And I feel like I'm living in a time warp. 4, question 4 is, who would you be or how would you feel if you didn't have the thought? Well, I'd feel happy and driven and motivated. So thoughts drive feelings. Feelings drive behaviors. And behaviors drive outcome. You want to be successful, you have to get your thoughts right.
Amen.
And what I love is question number 5 is take the original thought, all my colleagues hate me, and turn it to the opposite. Now, not the narcissistic opposite, all my colleagues love me. No, that'll never be true. But not all of my colleagues hate me. And I'm like, well, it's totally true. And when you do those 5 questions, the negative thoughts dissipate. When you don't challenge them, they expand.
Oh, yeah.
So writing them down and questioning them helps to kill them, provides protein for the anteaters. And letting them run around in your head provides the gasoline for anxiety.
So let's take an example. If you are going to tell yourself, I'm not sure if I can do this, or I'm special, or I'm just going to leave it because I think this is too difficult for me to do, or I'm alone and nobody cares. If you are going to repeat that thought, you feed it. So you give it food, you give it power. And unfortunately, you believe it, you integrate it, and it becomes a belief system. And then you're stuck, because then it's rhetoric. It spirals down. And that's why it goes to anxiety and it goes to depression. And when children remain in that situation, then we find that they give up. Does that make sense? Okay. So I normally tell children, this is like a car with a fuel tank. We are like cars. We are having a fuel tank. But if we are telling ourselves one negative thought, then we create a hole in that fuel tank. So your friends can tell you, I'm sure you can do this. Or, no, just try your best. But it doesn't stick because you don't believe it. You're not changing the thought. And that was some guidelines that he gave. If you have a negative thought, question yourself. Is this really true? Is this an emotion or is this a fact? And I always tell children, this is your thinking brain and this is your emotional brain. This is the hippocampus and this is the amygdala. You can forget about the words. If you are going to think from your emotional brain and you're stuck in your emotions, you're having trouble. If you think it through logically and rationally and factually, is this really true or is this my emotions? Then you have a good chance of thinking positively. Do you understand? So unfortunately, the children that have suicide thoughts are children thinking from their emotional brain. They are not questioning themselves anymore. They don't ask them, is this really true about myself? And that is why we say it can be prevented. So that is the reason, the cause why it happens. And the cure for this is to sit with somebody that has these thoughts and ask them, where is this coming from? And what are you doing with this? Now, there's a rule in trauma. Trauma will control you. Everything traumatic in your life can control you, or you control it. It's not what happens with us, it's what we do with it. Can you see the difference? So if we tell ourselves we are traumatized, we believe that person, but the first question I'm going to ask them is, what are you doing with what's happening with you? Are you giving up? Are you only feeling it? Or are you thinking this through? So this is the guiding tool I'm giving all of you. When you have a friend and they tell you, I don't feel anything anymore. I don't care anymore. I am not special anymore. Nobody cares. There's no reason for getting up in the mornings. And then you can tell them, is this based on feelings or is this based on real facts? And if there's facts, can I guide you to a counselor so that she can work this through with you? That's why we feel it can be prevented. And I think that is the biggest concern or reason from my side is that the children are alone. They don't go to counselors. They don't go to a friend and open up to them. And the other thing is when we are going to be feeling uncertain how to deal with it, our friends won't approach us. They won't. But if you have an open face and you go to somebody and tell them, why are you so quiet? What's going on? Talk to me. Explain to me. And they're telling you negative thoughts, giving you negative thoughts about themselves, then you can tell them, have you ever thought this through or are you only feeling this? So here you've got some guidelines on what to do. And we call it suicide ideation. Suicide ideation is when the thoughts are in their minds, but they haven't gone through to the action to do something. But it's very dangerous already to have suicide thoughts. So that thoughts is alarming, and that is the risk factor that we look at so that we can manage this with people. Have you ever encountered a friend that you were concerned about? That raised something like, I don't care anymore, I don't feel anything anymore. Life isn't really something that I would want to get up for anymore. Most of you maybe had something that you've heard, a voice like that, a message that a friend has given. And then we will tell ourselves, we don't know what to do with this. So now you know there is a pathway that you can take. There's numbers that you can call. If I'm not available, there's a list of numbers that you can call. I'm going to give this list to you guys. Look at all that numbers. So you can call somebody to help you, to guide you, to direct you, to assist you, and to tell you, okay, this is what we're going to do. Give me that friend's number, name, so that we can get somebody there. Okay. And then also I'll give some direct numbers in Nelstroom, here where we are, that you can make use of. This is my presentation. Now I want you guys to ask me questions. Anybody? Okay.
We will set up a meeting with Dr. Rhona and then we will assist you financially where possible. And if you want to have it private, we can have it private, but you have to come to us and say, I need help. Please reach out to us. Be honest with yourself, be honest with us, and we will get you help. We want to help you guys. We don't want you guys to harm yourself or worse, to commit suicide. So we are here to help you guys. The offer is on the table. If you really, really need assistance, come and talk to me, come and talk to Janita, or if you can contact Pastor Johan directly, and we will set up a meeting with Dr. Rhona. And like I said, Pastor Johan said we will assist you guys financially if you come and ask for help. Okay? Please don't try and sort it out yourself. Please don't use drugs or alcohol. Try and numb it. please don't self-harm. Rather come forward, be honest, and talk to us. Talk to a professional that can help you and guide you on the right path. The door is open. We are always here for you. We care for you, and we want to help you. And we don't like it when we see our teenagers hurting. So please come forward and talk to us. Okay? Okay, yes, Keith, sorry. Thank you for the guys that's on YouTube. Thank you. It's recorded. It will be cut. It will be sent out. If you guys want to rewatch it, it will be on YouTube. Thank you guys for being online. So can we give Dr. Rhona a round of applause? Thank you, Rhona. We appreciate it very much.